This we've not done this monthly webinar before, but it's a really important subject, and I'm very excited to listen to the lived experiences of our external speakers. So this webinar is coinciding with Black Maternal Health Week. Oh, hold on. And if you've been to any of our webinars before, you should know me. I'm the healthcare manager, training manager for Down Syndrome UK. I'm also a parent of a teenager with Down syndrome. And I'm really pleased that we're joined today by 3 of the 4 founders of Black Child Down Syndrome. So we've got, and they'll introduce themselves and their foundations, and I'll go into, at the end of the webinar, more of what each individual organisation that they're involved in does if they've not covered it in their talk. So we're joined by Tonye, who's the founder of Simone's Oasis Foundation, Denise, who's founder of Panda's Tree, Black Down Syndrome UK, and Onnis, who's the creator of 21 Alchemy. They're all parents of children with Down syndrome, and we're very lucky that they're going to share their lived experiences with us today. But I'll go into more detail about what Black Child Down Syndrome is later in the webinar, but also, like I say, what their organisations do if you need to do any signposting. So just as if you haven't been to any of our webinars before, just as an introduction to Down Syndrome UK, we have a healthcare arm which is positive about Down syndrome pads, which hopefully you know about. We work very closely with midwives. We've got iLearn modules with the Royal College of Midwives, which is to do with Down syndrome and breastfeeding. We work with the Institute of Health Visitors. We've done quite a lot of research which has been published, and also Nicola, our founder, and I are both part of the National Down Syndrome Policy Group. So we are part of, hopefully changing policies in the UK, well, England specifically, the Down Syndrome Act. So just to show you that we're a credible organisation, we do our surveys every year, and this is our latest one to show you that people do use us, parents do use us as resources, for our information and our support. And thankfully, year on year, every time we do these surveys, the statistics are getting better. Hopefully we'll be at 100% by next year. So our role really, mainly in terms of healthcare, we feel that we're championing the lived experience, and we do that by empowering the parents, making sure that they know that they're part of a strong and supportive community. We use that lived experience to educate professionals like yourselves by using the evidence-based insight and ongoing support, so that you can use the lived experience to form best practice. We use the lived experience by affecting change, by lobbying the policymakers, and hopefully by using the lived experience we are enlightening the public as well. So since we've been going, which is, I think we're in our 10th year or 9th year now, we feel like we're filling those gaps for parents so that they can get the support they need when they need it, Down syndrome specific support. But it's not just about the parents, is it? It's about professionals and making sure that you have the education surrounding Down syndrome and the information you need to support the families that you come across. So in terms of Black Maternal Health Week, we really wanted to centre the voices of Black women and families of children specifically with Down syndrome. We want to reflect on their maternity experiences and the outcomes that they've had. And the goal is really to explore how maternity care can be more equitable, inclusive and informed. That is the goal, because there are disparities there. And hopefully for you to learn from the lived experiences so that you can improve your professional practice. So I'm rushing through this because I really want our speakers to, have the main part of this webinar. So as you know, Black women in the UK are around 3 times more likely to die in pregnancy, childbirth, or in the postnatal period than white women, which is a shocking statistics. And babies of Black mothers face higher risk of stillbirth, preterm birth, and low birth weight. And nearly half of Black women who raised concern during labour felt they weren't taken seriously or listened to, and they felt they didn't receive appropriate help or pain relief. So these are massive issues. Ultimately, many Black women feel, oh, hang on.
You're right, Susan.
Yeah. Okay. hopefully everybody's muted that needs to be. Many Black women report not being listened to, believed, or adequately support during maternity care, and that is why we are here today. As I've said, Black women face significant disparities in maternity outcomes. And in terms of Down syndrome, families, Black families who receive a diagnosis of Down syndrome from with their child may experience lack of culturally sensitive communication, limited representation, which is what these women will be telling you about, the fact that Black children with Down syndrome really are not represented very well in society. And they may experience additional emotional and systemic barriers. And really, ultimately, listening to the lived experiences help drive meaningful change. I think it really is important. So these disparities are not about individual blame. It's more about systems, structures, opportunities for improvement in how care is delivered, which is what we want. And again, listening to those lived experience is essential to improving those outcomes. So we're, really pleased that we have these ladies speak to us today. So Black Child Down Syndrome, which is they're all founders of, is a community focused organisation which is dedicated to supporting Black children with Down syndrome and their families. And who, I don't know if she's joined us actually, but Marsha is another one of the founders of Black Child Down Syndrome, who herself is a founder of Black Send Mamas, but she's not a parent of a child with Down syndrome, so she's not sharing her lived experience today. And so they work together to raise awareness, provide resources, create safe and inclusive spaces where families can connect, share their experiences, and access culturally relevant support. So it's a really good organisation, and definitely it was Black Child Down Syndrome that got me, that caught my eye originally. And so through advocacy, education, community engagement, they aim to challenge the stigma and ensure that every child with Down syndrome is valued, empowered, and given the opportunity to thrive. So really good aims there, but they will explain more, obviously. So there is a strong social negative stigma attached to Black children with Down syndrome, and there really is a lack of representation, and that can have profound consequences on the communities, and families feel isolated with little to no role models that can reflect their experiences. And also, in addition to this, Black women face higher risk of developing mental health problems during and after pregnancy. So I think that's all I really want to say as means of an introduction. So I'm going to hand over to the founders of Black Child Down Syndrome, starting with Tonye, who's founder of Simone's Oasis Foundation, who's going to tell you her story. So over to you, Tonye. Shall I start with the first slide?
Yes, please. Hello, everybody. My name is Tonye Falugi-Ekezie, founder of Simone's Oasis. I am going to rush through this. I'm very conscious of time, but not too fast. So I was raised, I've grown up between 3 countries, which is the UK, Nigeria, and the US. So my experiences kind of range between there, and I'm British and Nigerian. Let's go to the next slide. So I have 3 children. My last 2 are my biological children. And it was a shock to me when I first had my first one that I was called a geriatric. It was a geriatric pregnancy. I'd never heard the term. And I still to this day find it really, really hilarious. And I'm like, gosh, I'm that old already, geriatric. I was like, okay. But because of that, obviously you are prompted to have, an anomaly test, and particularly with my second, Simone, which I had her at 37. And both times I opted out of the anomaly, but particularly in the second pregnancy, every time I went for an appointment, they would keep bringing the fact that I should have the anomaly test. I should have the anomaly test. And I said, each time I would tell them, no, I don't want the anomaly test. I'm fine with having the child I want. And every visit, it became more and more aggressive. And they would tell me, the things that could happen, the implications that could happen. And there was a time I said to them, okay, if I have the anomaly test and the child comes back with some kind of issue, what is the next step? And immediately they went into the option of aborting the fetus. And for me, that wasn't the decision I'd want to make. And so I refused the anomaly test. And again, when I went back for an appointment, they were aggressive about it, that the person was aggressive about it. So I had them put in my file because I was so upset that to not ask me that question again. And I was labeled as aggressive. Now, I know I can be intimidating. I am absolutely gorgeous. And I'm 6'2". And opinionated, but I'm in no way, my nature is not, I'm a very friendly person. I don't have resting bee face. And it shocked me to be labeled as aggressive. Now, I come from a very privileged background. I went to British, public schools. I live in a nice area in London. So I hit them with all the Queen's grammar and all the poshness. That they didn't assume I had, which for me, I found very offensive. I really resented. And I, after that, I refused to go there and opted to be put to another clinic, which I was. Can I go to the next slide, please?
Yep.
And you can see on that one is my face. I was like really upset. This slide shows it. But it was really empowering to find my voice and say that. But again, I could do that. I come from a privileged background and I'm supported. And the nurse, the clinician I had there was amazing. And she was Nigerian. So she understood what I was saying. She understood why I was saying it. She understood the cultural background of it. And after that time, I had no problem. Next slide, please. So I had both my kids in the US. Why? My husband isn't British, he's Nigerian. And we were too lazy to apply for the UK visa. So we had the babies in the US. And I had said previously to log into Lou, I said, I wish we could do this for our American brothers and sisters. Because I'll just quickly say that in my birthing experience, when I was given anesthetic for my son's delivery, who was my first, it only worked on one half of my body. So they actually didn't give me, I think, enough anesthetic. And we know the history of Black women and pain relief. The issues there. So when I had my daughter, I refused any kind of anesthetic and just pushed. But what was really interesting is the journey that happened post-delivery with my daughter, and she's the one with Down syndrome. She was not diagnosed at birth. And when we came back to England, she was not diagnosed with Down syndrome here. It's when we went to visit family in Nigeria that the pediatrician looked at her and said, I want to test her for Down syndrome. And I was shocked because I had never seen a Black person with Down syndrome. I didn't even know that Black people got Down syndrome. And so I was, I'm like, yeah, go ahead. She has like Chinesey or slanted eyes because my husband had slanted eyes, So I was like, yeah, whatever. She's not going to have Down syndrome. Black people don't get it. Like, what are you talking about? And lo and behold, as you can see, she came back with Down syndrome. And that journey kind of changed everything because from there, as you know, you go and you do the echocardiogram. And that's when our world really changed because it was the echo that the cardiologist told us she was in heart failure, that he'd never seen anything like it, a baby that looked healthy, but inside was, she was pretty much on her last leg and he gave her 6 months to live. So somehow, in the transitioning from the US to the UK, all this had been missed. And I didn't even realize that Black people got Down syndrome. So we had to go back to the US. She had her heart surgery there and took a long time in recovery. And part of recovery, we moved back to the UK. And we got assigned a social worker who, when that social worker visited us and saw where our flat where we live, after that, she ghosted us. And I called, I texted, I didn't have an idea of what I was meant to be doing. And the person who was meant to help us ghosted us. And so luckily, you know, the GP practice is amazing, and I was able to talk to somebody there, and she put us in contact with the portage service. I didn't even know what a portage service was, and was able to connect to some amazing people there that told me to get in contact with Downright Excellence, and really walked me through what to do. However, it just took such a long time to access anything. And I think that's a typical experience of everyone. But again, because I'm like a dog with a bone, I always following up, calling people, trying to find who my allies were. And it really made me understand that within the system here, there are absolutely amazing people working here. But they're working within a broken system. And unfortunately, again, we had an issue with a lady at Royal Brompton, a cardiologist, and we just, you know, she was really patronizing. She spoke down at me. She treated my daughter terribly. And I had to speak up, you know, I had to talk, you know, we went head to head, you know, and again, I was labeled as aggressive, but I wasn't going to take that. I was knowledgeable at this point, having gone through the different systems and the different organizations and the reading. And because we had come from the US, we had had a lot of access that we didn't have here. So I was coming with that knowledge as well. And we had an amazing cardiology team in the US. So I was able to counter a lot of the stuff she said, but yet again, labeled as aggressive. But I reported her. And then we were assigned a different hospital, and we were assigned a different cardiologist. And he was amazing. He finished, it was like he would finish my sentences. And the experience really changed for us. You can go to the next slide. I'm wrapping it up really quickly. And, you know, one thing that this journey has really shown me is that there needs to be more of a humanization of us as people. Us advocating for our children isn't being aggressive. Why do I have to temper my voice or make myself a little bit smaller to make you feel comfortable? Because you perceive my questioning, not in an argumentative way, as aggression. And so part of what we do, that's my time, part of what we do is create these stories that are based on my children and my family, and to raise awareness about Down syndrome within the Black and African community. But because the wider audience also, we interact in an inclusive society, it's to understand as Black families, wherever we are just like everybody else. We have the same needs, we have the same wants, we all want to be loved. And it's just that understanding that we're more alike than different. You can go to the last slide at this point. I think the next one is the last slide. So, and that's how we founded Black Child Down Syndrome, so that nobody else is going to be like me wondering that, oh, I didn't know that Black people got Down syndrome, because that's ridiculous. And just to work with everybody that's within the healthcare space. We're all human beings. You guys are doing a great job. We need you. We appreciate you. And we want to help you do what we do better. This is what I do for a living now. I write amazing children's books. And I'm just really, really excited that this is the first opportunity for us to share our lives. And I will pass it on to, I think, Denise, who's next.
Yeah, thanks, Tonye. I appreciate you sharing that with us. So yes, oh look, there you go, and you're saying thank you, and that's how you can get hold of Tonye or get any more information about Simone's Oasis and those books that that she was showing you. So yeah, I'm now going to move on to Denise, who is the founder of Panda's Tree Black Down Syndrome UK, and she's hopefully going to tell you her story. Over to you, Denise.
So thank you. Good afternoon, everybody. My name is Denise B. Grant. I am, as Lou said, the founder of Panda's Tree, Black Down Syndrome UK. I'm a former educator, and I recently founded a organization or company, Send Parent Partnerships, where I do training on exactly this thing, the parental lived experiences to all types of people in society. I'm going to start off by talking about the importance of care, and with that, to some degree, cultural competence, which often has been lacking in my journey. Um, I think it would be amiss if I didn't just give a small synopsis of my own medical history and how I kind of landed here with my daughter. My daughter's name isn't Panda, but that's the pet name, by the way, that we give her. So just to clarify that. I, as a Black woman, in my sort of probably most of my life, unknowingly had a condition called fibroids, which does impact a lot of people from my cultural group. Those fibroids were ignored and ignored and ignored, to the point where I was in so much pain. I just kept on getting ignored by the consultant, and I knew something was wrong, but I had no idea what it was. I even ran a 5K run, I will say marathon in my head, but a run with this condition, with hemorrhaging, and had no clue. And although I reported to the hospital on a number of occasions, that was ignored and ignored and ignored again. I am the product of a fabulous, now retired nurse and midwife. So I usually go back to my mum when it comes to medical issues. And she sort of said to me, I think you should take a pregnancy test. And that pregnancy test came back as positive. And it was quite shocking to have a positive pregnancy test when I'd been told the whole time these were my fibroids that were hemorrhaging. That resulted in me having to self-diagnose an ectopic pregnancy, which I had that time been carrying around for a number of weeks, undetected. So when we talk about the maternal health of Black women, I think what often is forgotten is that every single one of us comes with a history. And that history needs to be looked into, it needs to be remembered. And also, there has to be a sensitivity with people when dealing with the history of patients, because I didn't get that. I diagnosed my own ectopic pregnancy technically. I also, while pregnant with Panda, had obstetric cholestasis. Apologies, I'm the only non-medic in my family. And I diagnosed that myself. My maternity care was, to say the least, poor, to the point where I had to make a complaint to the lead midwife person at my local hospital that I was attending, and actually sit down with them and talk about the type of care that I believe I deserved, I should be getting while pregnant. So I've had sort of near-death experiences when it comes to maternity care. I've sued an NHS trust successfully, unfortunately, I would say, all because of the care that I received and the lack of sort of need to listen to me and what I was feeling in my own body. When it came to Panda, there were issues. We didn't get a so-called prenatal diagnosis. What we got was a really odd percentage of 95%. Now I know different, right? But 95% not having Down syndrome. I'd passed all of the other tests that you have, I think around about 5 months. And it said that, I was the type of person who wasn't at risk of having any of these conditions, and then got to 95%. And so with the 95%, I took it, I ran with it, and I thought, yep, things are going to be fine. And I want to say that throughout this whole journey, I have had to do a lot of self-advocating in order to just get this far. Can I have the next slide, please, Lou?
Yep.
So what I will say, if you look on the slides, if you can see them, this is Panda, and these are all of her, some, not all, but quite a few of her medical issues and challenges that she's had throughout from the moment she was born. I will say I've had moments of good medical care. We've had great ambulance rides, for example. They've been very engaging and very entertaining. I've learned that that can be a postcode lottery. We have a very specific hospital that we frequent in London, and to sometimes get ambulance drivers to take you to that hospital because that's where they know her best can sometimes be quite challenging. We've had, in my opinion, an excellent pediatrician. When she had infantile spasms, he spotted it straight away and sort of put us on the right trajectory. We've had consultants where they have jumped on the surgeries of other consultants because they didn't want to put her under general anesthetic too often. So we've had, for want of a better phrase, there are some areas of good care. And then we've had other sides that have been challenging, like hospital appointments with audiology, naming and shaming, where nobody in that team knows how to sign. And I just find it bizarre that people who deal with people who don't hear actually don't know how to sign. I've had to tell off consultants when she was very little and they were looking into what's called Hirschsprung's disease with her. This doctor wanted to stick an implement up my child's backside and do that without any anesthetic and any information, anything, to which my reply was, would you like me to try that on you first? And so these are the things that happen because they think that our children even have a higher threshold of pain. They think that us as parents don't know what should or should not be happening. And, I've had we spent a lot of time in hospital, I will say, on and off the first 2 years. And we have had a lot of consultants that until I specify my credentials, they didn't care about what I had to say. And if you think about many people who are not able to voice their background as something that is has notoriety or some kind of significance before they actually try to do their jobs. So that's a really big problem in my mind. Can I have the next slide, please, Lou? So the interactions with professionals have been up and down. There have been gaps in care and gaps in clinical knowledge. As I mentioned, sort of prenatally, given a random percentage, I don't think that's the right information we should have received. Lack of cultural understanding, which I think Tonye mentioned and Lou as well, where aspects such as how to treat people with knowledge of what would be acceptable culturally and being sensitive to people's cultural and ethnic differences. There's a lot of misguided training regarding that. And in addition, there is no real thought for any trauma that mothers in our community may have received at the hands of professionals, period. There's a lot of assumption-shaken communication where people assume they know about what they should do to us rather than including us in the conversation and making sure that we are able to be require the knowledge that we need to make the decisions that are right for our children. And in addition to that, the absence of signposting, which I think organizations like PADS and my own try to do within all of the Down syndrome community. Tonye mentioned portage, I call it portage. She mentioned them. And they were key as well. But I only found out about portage because I had a health advisor who in my head was an old Jamaican auntie who basically advised me of what I should do regarding, and there's this organization and maybe they can help. But even within that, there was assumptions made that, okay, so everybody else was going to this wonderful conductive education training. It was assumed that I wouldn't be able to go because I didn't have a car to get there. It was assumed that I wouldn't be able to go because I work 5 jobs, so I wouldn't be able to take my child. It was assumed that, there were all these assumptions that they make about people from our background that are relatively, non-existent and don't work. In terms of signposting, there was nothing, and this is what also PADS does, there's nothing that was talking about the medical and the therapeutic, the speech and language, the OT, the physiotherapy, the hydrotherapy, the conductive education. All of that I found out for myself. And I feel like it would have been really nice for people to just have that knowledge in their arsenal for any kid of disability, realistically, to be able to do that. And therefore, I decided to create Panda's Tree, Black Down Syndrome UK, and work collaboratively with my colleagues here on the Black Child Down Syndrome project, because we need to get this information out to our communities, and we need to make sure that people are receiving the best medical care that they can get. Can I get the next slide, please? This is Panda. So moving forward, I want to say that representation matters. I want to say that we need to center on the lived experience of the individuals. We need to create culturally safe practice environments. We need to involve the parents as experts. We need to build inclusive support systems, and we need to hold complexity and not ignore the importance of the intersection of race and disability that comes about. Can I get the next slide, please? So I hope that you understand that representation matters. This is why we created Black Child Down Syndrome. It's not just for our community. Thank you. It's not just for our community, but it's for everybody. We need to understand that language matters, and the language that matters, that listening to your patients and even the children, because, you know, just because they're signing, it doesn't mean they can't speak and they don't have opinions about their lives. Having that co-productive parent-professional relationship matters, and that if we understand this, we understand that every single community is able to thrive when all identities are recognized and their medical care is taken into recognition in a way that is valid. Thank you.
Oh, thank you, Denise. Can you tell me what Panda's name is? Because I don't think I've ever known.
Her name is Aralise.
Aralise, nice. Thank
Aralise.
you. Thank you so much for sharing that with us. So I'm going to move swiftly on to Onnis, who's the creator of 21 Alchemy, who's going to hopefully share her story. Over to you, Onnis. There you go.
There we go. I'm unmuted. And this is me and my wonderful son, Epidemac, who contextualizes why I am here. I don't have any other slides, so I don't mind turning them off and just speaking to you. So my name is Onnis Sankara. I am a mother to Epidemac, and I'm also a playwright. And I'll talk a bit more about what I do sort of at the tail end of this, because I know that we're strapped for time. So I'm going to jump straight in. I am a creative, a playwright, so I'm going to use some of my creativity to just give a backdrop to what I walked into my maternity journey with. And this is from a play that I've written. Enter the extraordinary world of the Black woman's womb. Damned if you don't, and damn if you do. Too late or too soon. The portal to the universe where human life first set forth. Yes, we are talking mitochondrial DNA. They call her Lucy or Eve, or so they say. You're welcome. Mother of civilization, the womb of nations, infinite creation, and the absolute fascination. From Venus Hottentot, Sarah Bartman, God rest her soul, to Henrietta Lack, whose families are only just getting facts. May she rest in peace and justice. And I'm sorry, I don't know your names. All I know is that you came, you saw, and they conquered with their corporate sponsors and instruments of mass death and destruction, following the instructions that we are strong, superhuman, in fact. So much so that we don't even feel like we're not even real. And that was a piece from my play, which I feel contextualizes the weight and the complexities that Black women walk into their maternity journeys with. So that being said, I had a very good pregnancy. Because of that complexity, I kept my interaction with the medical system as minimal as possible. So I went to all of my scans and I did what was necessary, but I didn't get any tests or anything like that to see if there were any anomalies or anything like that. I just, as I said, kept it very simple, had a home from home birth in the hospital, and my son came out healthily, naturally in water. Maybe that's why he likes water so much now. And came out in water. And then it was after that that things had changed. A medical professional said to me that they suspect that my child has Down syndrome, something to do with where his ears were and something to do with his nose and whatnot, but they wouldn't be sure until some tests that were done, and they wanted me to stay in the hospital so they could do certain tests and checks, etc. That was and that was a mixed bag. That was a mixed bag, that experience. One of the challenges that I had in the hospital was that my son, he wasn't gaining weight. And I was trying to say that I do not think he's latching properly. So I don't think that there's something fundamental, there's a fundamental issue why he's not gaining weight. It's just that I don't think he's getting food. And what I was being told was that, oh, well, look, babies with Down syndrome, oftentimes they have problems feeding. So forget about, you know, kind of like the breastfeeding. And actually, if he doesn't gain weight in the next day, we're going to have to tube feed him and all of this stuff. And I was like, whoa, hold on, right? Many babies have problems and challenges latching. You know, we just needed to get that right. And so I wanted to get help with feeding, but I was being panicked and told that no, these babies don't do this, and everything was being attributed to Down syndrome. There was one nice nurse on shift who did hear me, and so she did try and give me pointers to support my my breastfeeding. But it was a really challenging experience because I'm not medical, but you know, I knew what was happening in that situation, and I wasn't being listened to. On the positive side, I can say that they were very thorough with all of the tests and the different things that were done. When I finally did get my son's diagnosis, it was given like a bit of lead, really, in terms of I was given all this stuff that he may not do in his life, and it was a lot of limitations. But I was told that it's okay because these people with Down syndrome tend to be happy, and it's like they don't grow up. Yes, that's right. I was told that my child was going to be Peter Pan and not grow up. And so from there, I kind of tuned out. I just wanted to know, what did I need to know to support my child and get out of the hospital so that we could learn how to feed and he can get what he needed. And I was away from being threatened with tube feeding every minute. And obviously, if it was something that my child needed, I would give it. But this wasn't what was taking place. Fast forward, leave the hospital, and I get a lactation consultant, a private lactation consultant, who supported me on the breastfeeding journey, and he breastfed for nearly 2 years. And after that, it was quite a bit of a whirlwind. One of the things that was picked up, to the credit of medical professionals, was that my son had cataracts, and he would have to have operations, which he proceeded to have at like 3 and 4 months. But it's interesting because we're talking about the maternity journey, and you know, and I'm thinking about the kind of postpartum, but the postpartum felt like it started at the end of postpartum because of the experience of you're going to appointments, and you don't actually have that kind of initial kind of bonding time that I imagined that I would have, not have, you know, when I didn't have a pre-birth diagnosis. I know that time is ticking on, and so once again, I'm going to use some of my creativity to speak to where I was at the end of my postpartum journey. And so I'm going to, and in the play, because it's creativity, so given some context for the play, it's based off of my lived experience, but also I did research with other parents of SEND children and parents of children with Down syndrome, and this is what has informed this work. And the aim of that work is all of the aims that we've spoken about before, but also because I know the power of creativity as a means of getting our voices, sometimes in rooms and spaces that they wouldn't normally be in, and using that for training and education and awareness, etc. Okay, so, and the character is based on my son, but in the play, his name is Judah. This week, finally, it's quiet. Time for me and Judah. And yes, we still have to get results from tests, and he'll need an operation on his eyes, yes, and all of the rest, but I just need to take a beat and rest, to breathe and be and take it all in. What am I thinking? What is he feeling? What am I grieving? grieving the lack of celebration of my son's homecoming. Something feels broken, like those early moments were stolen from us, marred by all the panic and the fuss, no time to just be. Plus, no newborn picture on the wall of fame. My mum has a wall of fame. All of the family live there. She has everyone's picture, and it gets bigger and bigger with each coming year. So where's Judah's newborn pic? No one had time to take it. No hospital photography service for my family. So now here we are, Judah and me and an iPhone 6, and I'm reclaiming those stolen moments and taking my own pics, because do you think I'm gonna let this little piece of diagnosis spoil our fun when his little life had just begun? Excitement for this very hour that I get to adorn him in gifts from his baby shower. Blue and white, that feels right. I'll dress him in blue and white, so delicate and bright. What a beautiful sight. But what will they see? Will they see that he looks like me? Or will they see that he is different? Will they see signs of personality, or will his uniqueness trigger ignorance? On this voyage that has already departed, as I trip up, catching up to what has already started, still not knowing where to start. So I lead with my heart. Snap and send to close family and friends. And that's where I finally got the opportunity to just have those moments. And my play, my project, my organization is called T21 Alchemy. You'll recognize T21 from trisomy 21, but also, and the alchemy is the process of turning lead into gold. And my diagnosis and the experience that we were having was given like a big ton of lead. And I've watched my son's life and his personality, and actually watched that transform into gold. And so through my work, I want to be in different spaces to support people's perceptions turning from into gold. And this is what my colleagues do in their respective work. And this is what we do also within Black Child Down Syndrome. And DSUK is also in that T21 alchemy of turning these experiences, these shocking statistics, spreading awareness and turning that into gold. So that's T21 alchemy.
Excellent. Thanks, Onnis. I love that. So I'm just going to really rush through just a couple of summaries, because I really would like to see if we've got any feedback. We're really getting to the end, but if you are able to stay on, please do. That would be great. So in terms of equitable maternity care, moving towards that, our advice would be, this is all very obvious and I'm sure you're doing it anyway, but listen and act. Take concern seriously and respond promptly. Avoid those assumptions. Every experience obviously is individual. Communicate with care. Use clear, compassionate, non-directive language when discussing Down syndrome diagnosis. Ensure the information is balanced, sensitive, and what we're talking about here is making sure that it's also culturally aware. And make sure that you acknowledge and respect any cultural differences or perspectives, as well as their lived experiences. Support. This is general, obviously. Support families to make decisions without pressure or bias. Offer accessible, relevant information, signposting to support groups. We now know of Panda's Tree and Black Child Down Syndrome and Black Down Syndrome UK. So please, if you come across Black families of children with Down syndrome, think about signposting specifically to those groups, in addition to your local support groups and anything else that PADS and DS UK do. Build that trust and continuity, foster relationships where women feel heard and they feel safe and they feel respected, and then that trust is built up, because I think a lot of families, Black families, are saying that they lose that trust because of some of the words that have been said or how they feel they've been treated. So promote continuity of care wherever possible, and learn from the feedback and lived experience. So equitable care starts with listening, understanding, and taking action. I'm just going to I'm really sorry, but I'm going to fast forward through all of this just so that we can maybe get some questions. But if you want to know any more about the organizations that Onnis and Denise and Tonye are involved in, do email me or contact them directly. But I can definitely signpost into what you do, to what they do. I'm going backwards now, sorry. So our lunchtime webinars, you know, feel free. Our next one, I think, is specifically for health visitors. And think about Black Child Down Syndrome. We've got an exhibition on in London currently. Do think about going along there if you're local to them. So what I really want to say is fill in our evaluation form, because this is a new webinar for us, and we really would like to know your opinions on how we can make it better, whether you felt that you've found it useful, what you found useful, and hopefully you don't feel like you've wasted 45 minutes of your time. But if that's how you feel, please let us know and let us know how we can make it better for you, because this is about you and you know, helping you to you know, to hone in your best practice and make sure that the lived experiences are good for specifically for Black families. So I'm going to stop sharing now, and hopefully if